afternoon, everyone. Thank you very much for having me. It's a great pleasure to be able to join expert speakers here in highlighting the issues and challenges in lower leg care to help improve the quality and the amount of support and care that is available to people with chronic wounds. This is important because it carries costs, not least those personal costs where we think about the quality of life, health-related quality of life and well-being. In research, there has been this renowned interest in evaluating the health-related quality of life, including studies that look at the Cardiff Impact Wound Schedule. But what I would like to share with you today are the personal, experiential aspects of living with a chronic wound, which I learned about during my extensive research in the wound healing and wound care community. So I would like to draw on my doctoral work in outpatient wound healing clinics and reflect on the insights that I've gathered working with members and volunteers in the leg clubs. I want to look at two aspects of living with chronic wounds. It's specifically the physical and emotional aspects of having a chronic wound, but I also want to end on a positive note and reflect on the commitment of those affected individuals to improving the quality of care for other patients by becoming an active member of the wound care community. And I would like to draw on the narratives that patients and members, I will be using these two terms, shared with me to do justice to those narratives. Starting with those physical aspects of wounds, of living with chronic wounds, as the speakers have already highlighted, pain, exudate, infection, smell. Indeed, patients spoke to me about what I call the social correlates of living with wounds, and in particular the wound appearance, wound smell. That meant that many patients felt socially excluded, felt anxious, often stayed at home, housebound. Patients who I spoke to told me that wounds were not very nice to look at. They described them as stinky, mucky, messy, gooey. Welcome to the horror show was one modern greeting used by a patient in an outpatient clinic back in February 2016. And in particular, wound smell was something that was very often highlighted by patients as something that had those horrible relational repercussions, implications for family relations. One patient told me that his wife would often sleep in a separate bedroom because she couldn't stand the smell. A member in the leg club told me that he would have to lie to his grandson about the smell in the house, telling him that the smell was coming from the sewage because he felt embarrassed to admit that this was his wound. So in the words of one of the nurses that I spoke to, individuals with wounds don't often go to public places because they are frightened that others will be able to smell their wound. And indeed, during my research, during my data collection, I heard a story of one patient who stayed indoors, stayed in the house for 4 years because she was too scared to come out because of that smell. Fretfully confiding in clinicians that patients felt smelly and dirty, they often stayed at home, drained with exhaustion, withdrawing from social life. As one patient told me, it's a big burden, you can't go places because you don't know when the dressing, is going to fall off. Because that's what happens to it. Gets so wet, it just comes away. And here's a quote from a patient from a waiting area who said to me, I don't know whether you noticed, but I was standing in the corridor. I couldn't sit in the waiting room and see all that. I think I've got fear that I can't look. And I think what these experiences demonstrate is that wounds, even when they are dressed and therefore hidden, can make patients feel like they stand out. Then they can make patients feel very insecure. And this very much echoes a sense of stigma of wounds, which is what my work has focused on. Wounds put a strain on familial relationships, on friendships. They can lead or risk breaking those interpersonal connections. However, I also learned that one important way for patients to get out of this horrible situation is to become an active member of the wound care community. And I think leg clubs, with their collective setup, collective treatment, are an excellent environment for that. Because one objective underpinning the Leg Club philosophy is to destigmatize the condition by bringing people together, by increasing their self-esteem, their self-respect. In my research, members in the Leg Clubs often told me that that feeling of social isolation was reduced when they became part of a community of individuals who all dealt with and understood the significance of the condition that they had. One Leg Club member told me that it was very reassuring for her to know that other people had foot ulcers. Another explained to me that collective treatment was good because they were all on the same boat, they all had it, and there was nothing to hide. Another gentleman showed me photographs of his wound that healed in the Leg Club environment, and he wanted those photographs to be published wherever they could be published in order to stress the power of the community in making people feel better about the condition and therefore more empowered to take an active part in the decisions about their health. And that willingness to contribute to the leg community, leg care community, wound care community, to support research and innovation is something that also came out very strongly from that doctoral work that I did. One of the patients told me, as far as I'm concerned, they can publish the photographs of my wounds in the news of the world. I don't care as long as it helps to sort it out. I don't care what happens if it helps somebody else. So we can see here that there is this focus on the plight of fellow patients alongside living with a condition that one has. And many individuals have this compassionate capacity to reflect on not just the severity of wounds, but also the burden that it brings to others, to their family members. And I think this is evidence of the power of the collectivity, the power of the collective to bring about change, whether it's just within the realm of the individual and their family or the wider wound care community. Thank you very much for listening.